Hi everyone. Today we'll be talking about a subject which is near and dear to my heart, which is scar therapy. Plastic surgery leaves scars. Please do not let anybody tell you differently. The difference between plastic surgeons and then regular surgeons is that we leave very subtle scars, very hidden scars, so they're not obvious. That said, there are measures that we use to make sure that the scar does not look awkward at a later stage, or it's not a very visible scar. Scar therapy begins after healing has occurred to a certain extent. So that healing period can be as early as 10 days and then as late as 21 days. So it can start anywhere between 10 days and 21 days. I like to do two types of scar therapies. The first kind is the intermittent scar therapy or the intermittent silicone therapy. And then the second kind is the continuous therapy. There is a role for both. There is a role for each of these separately. So what I'm playing with in my hand right now is a pair of scissors and a roll of silicone scar tape. But before I dive into this, here is a guide video. Actually, I have two guide videos regarding silicone gel-based scar massages. So that is what we call intermittent therapy. Intermittent therapy is done twice a day. It's done starting at approximately 2 to 3 weeks and it continues all the way to 6 months. What is this though? This is a silicone tape. There are more expensive ones on the market, but I recommend these because this entire roll will last a patient about 6 months or so. Anyway, so if you want to know more about intermittent scar therapy, you might want to check out these two videos. Coming on to this tape. So it comes as a meter tape. There are two parts to this. There's the backing film, and then there's this, which is the tape itself, the silicone tape itself. So let's say that you have a scar here. Like, let's just imagine that there is a scar here. Okay, I'm going to take a piece of this and cut that out with a clean pair of scissors. You can't tear it by hand. Unfortunately, you cannot do that. And without stretching this, just apply it really gently here. Okay? And just pat that down. So I haven't stretched it in any way. It takes a little time for you to get used to this kind of silicone, continuous silicone thing, because this is not very permeable to moisture, and usually skin is largely impermeable to moisture, but wounds as such are more permeable to moisture, which is why they have an angry purple, red, pink appearance in the beginning. So this will make sure that the transepidermal water loss is minimal. That's how these silicone tapes work. So you wake up in the morning, you do your skincare routine. I have a video about skincare routine. After everything is done, you apply the silicone, you actually do your scar massage before you do your face wash. So you've done your scar massage, again, refer to the earlier videos for this. And then after everything, and you've put your sunscreen on, etc., then you go ahead and put this patch on. It has an adhesive to it. Now the adhesive does get a little less with time, but you can always take it off. Rinse it with some warm water, pat it dry, and then once it's totally dry, you can reapply the same tape. To start with, you start with 2 to 3 hours on the first or the second day, and then you build up to 24-hour use. Why is this important? Because with 24-hour use, you get the most consistent results. Whatever you want to modify in a scar, you have about 6 months time to do it, and then beyond that, it's a little difficult. So scar tapes are used for wounds which look purple, pink, red. If your scars are white and flat, this product may not benefit you. That means that the scar has matured. We call it a mature scar, and it does not lend itself to silicone scar therapy. All right. So other than this, like, what can you do to further benefit your scar? There is this scar system which is available. I haven't found it in India, but you can apply the silicone tape. So, but this has to be unstretched. And then on top, you layer a pressure dressing with steri strips. There is a guide video on how to apply steri strips also. So you can combine this with steri strips. You can do a combination of intermittent scar massage, continuous scar therapy, and steri strips for best results, especially if you're prone to things called hypertrophic scars or keloids. I'll bring out a video about these soon and how I treat them surgically. But this is what I had to say. I hope you got a lot of information. So thanks for watching till the end. I hope that your scars disappear. And if they don't, please feel free to reach out. I'll be happy to help. And I hope you got a lot of info out of this video. Don't forget to share, like, and subscribe. And I will see you next time.